The most important three words in our Constitution are the first three: we the people. The mission statement for our nation, laid out in a supersized font so that no one would forget what this document, our Constitution, is all about. Our founders didn't start out by saying, we the privileged. They didn't call for a document in a form of government for we the powerful. Indeed, they wanted to make clear that the structure of the government that they were founding would be very different from those in Europe that functioned for the privileged and the powerful. As President Lincoln summarized, we're a nation of the people, by the people, and for the people. That's the vision. That's the vision I've been coming to the floor and talking about for the last year and a half, about the importance of a government that responds to the issues that affect the citizens across this country, that listens to the people of this nation. It's President Jefferson who said that the mother principle of the United States was that we have a government where each citizen has an equal voice. Admittedly, we had some deep flaws that had to be corrected to reach that objective. But that vision of each citizen having an equal voice said that's the only way that the government will reflect the will of the people. They'll make decisions that will reflect the will of the people. But of course, it's hard to hold on to that vision because the powerful and the privileged don't like that vision. They want a government of, by, and for the powerful and the privileged, not by and for the people. So the history of the United States is one battle after another between having decisions that make a foundation for families to thrive in the United States of America and decisions that raid the national treasury for the benefit of the rich. We see that battle time and time and time again. And we've seen it very recently in this battle over health care. But today I come to the floor to say that the people of the United States have had an incredible victory, a resounding victory over those who were championing government by and for the privileged and the powerful. It's really all about this bill, this Trump Care bill that originated in the House of Representatives, that proceeded to take and throw millions off insurance, more than 20 million people off of insurance in order to give tax breaks for the richest Americans. What did the House bill do? The House bill said, we will give to the 400 richest Americans $33 billion. Not $33,000, not $33 million, but $33 billion, the richest 400, ripping away health care from millions of Americans to pay for those kinds of tax breaks for the richest. In fact, just those tax breaks for the richest 400 in America would have paid for 700,000 Americans to have Medicaid, basic health care insurance. That's enough to cover the states of Arkansas and West Virginia, Nevada, and Alaska, all put together. And then we saw that House bill come over here to the Senate. And the Senate set up a group of the Secret 13. Is there anything more opposite of we the people than the Secret 13 senators meeting in the halls of this building, particularly choosing a room that the press wasn't allowed onto because they didn't want to be seen entering the room or leaving the room? That's how secretive it was. That's how embarrassed they were about the possibility of having the American people see what they were crafting. And they came forward with the Senate version of the bill. Now, the House version, the President of the United States of America called mean. He called it heartless. But the Senate vision didn't end up much different than the House version. The Senate version that would proceed to throw more than 20 million people off of health care as well. The Senate version that, through maybe the CBO analysis, Congressional Budget Analysis, would throw 1 million less over 10 years, 22 million instead of 23 million, but 1 million more over the first year, 13 million rather than 12 million. And indeed, it proceeded to constrain basic Medicare, Medicare as it existed before Obamacare, in such a fashion that over time, it would put a stranglehold on the Medicaid, and therefore was even meaner, if you will. It was even more heartless than the Senate bill. And then the Secret 13 and their leadership said, we don't want to have the American people see this, so we're not going to give time to have committee hearings on it. We're going to keep it out of the Health Care Committee. We're going to keep it out of the Finance Committee, because the experts will come and the American people will see just how terrible, how mean, how heartless this bill is. We had the 0-0-0 process. 0 days of committee examination. Compared 8 years earlier to the longest committee hearing and markup lasting 5 weeks in the Health Committee, the Health, Education, Labor, and Pensions Committee. We had the second longest committee hearing and markup in Finance 8 years earlier, the second longest in history. But again, the Senate leadership recently said no exposure in the Finance Committee, 0 days in the Finance Committee, 0 days in the Health Committee, 0 months for the senators to go back and talk to their citizens and talk to their health care stakeholders about what this bill would mean. You know that something is wrong when you have a process that has diverged so dramatically from we the people. Instead, the Secret 13 and the 0 days of committee examination and the 0 days in Finance Committee and the 0 months to be able to consult with healthcare experts and stakeholders, and most importantly, 0 months to be able to hold a dialogue with the citizens back home. But we did hear from citizens back home, as much as the effort was to hold them at bay, give them the stiff arm, prevent them from weighing in. They weighed in nonetheless. My office received well over 8,000 phone calls. And of those, they ran 84 to 1, saying, stop this diabolical Trump Care bill. And I received a whole lot of constituent mail, more than 25,000 people weighing in from Oregon back home. And they ran 36 to 1. 84 to 1, 36 to 1. When do you see such opposition? Maybe we saw such opposition because the people of the United States wanted to weigh in, knowing that only the powerful special interests were meeting with the Secret 13 to design this diabolical bill to rip health care from millions of Americans. Maybe that's why so many American citizens weighed in. And thank goodness they did weigh in. They filled our email boxes. They overflowed our phone systems. And they filled the streets, often going to our home state offices to say this matters. And it certainly did matter. Has there ever been a bill in the history of the United States that did more damage to more people than the Trump Care bill proposed here in the United States Senate? One of the things that the citizens of the United States did was to weigh in with their stories, with all of us, with all 100 members of this chamber. They wanted to let us know how unexpectedly they had been affected by having a child who had a sudden and dramatic illness, or a car accident that had occurred, or suddenly a family member affected with cancer, or emphysema, or leukemia, or multiple sclerosis. And the list went on and on and on. real people, real lives, real challenges, real we the people input. I heard from Caroline in Portland, the mother of 2 young children, who wrote to me sharing her story of raising a child with special needs and the help that the Oregon Health Plan had been to her family. The Oregon Health Plan, Oregon's version of Medicaid, and how terrified she was about not being able to afford health care for her child under Trump care. I heard from Gloria, or I heard from Leslie, who contacted me about his 3.5-year-old daughter, Gloria, who suffers from a rare genetic condition that has led her to live with near constant seizures and cystic fibrosis. She needs intensive, around-the-clock care and is able to get that care because of a special Medicaid waiver that helps her parents afford it. But with Trump care, she would have lost that waiver. And I heard from Jay and Eugene, who reached out to share his story of his battle with leukemia and stage 4 colon cancer. He was told he could only expect to live another 3 months unless he received treatment. That was 2 years ago. And he's alive because he was able to access treatment. He's been able to fight the battle with cancer and fight the battle with leukemia. And he was able to do so because of the insurance he had through Obamacare, through the Affordable Care Act. And Carrie from Corvallis wrote to me, terrified about all the members of her family who would be uninsurable if we passed Trump care. Her husband, because he had a blood clotting disease. Her son, who suffers from epilepsy. Her 87-year-old mother, who has Alzheimer's. That fear of being unable to access health care because of a pre-existing condition ran through story after story after story. But that is the system we had in the United States of America before we had the Affordable Care Act. And then there was a woman from Ashland who asked me not to share her name, but wanted her story shared, and I'll call her Katie. Katie, a single mother who is currently battling cancer, invasive breast cancer, and malignant melanoma. This is what she wrote to me, and I quote, "In simple terms, I will die without treatment, and the ongoing care that I have received so far through Oregon Health Plan. As a single parent, I could work 24/7 until my last breath, and still my income would not afford me the basic health care if it was not for the Affordable Care Act." Katie continued, "With a pre-existing condition, I would not be insurable, left to suffer, and even to succumb from my illness. Once this was only a nightmare, but now it is a horrifying reality, too surreal to comprehend. I cannot explain the deep heartache and frustration of the thought of orphaning my son, all due to dying from an illness that could have been treated if I'd been insured." Stories like Katie's and Caroline's and Gloria's keep coming in, day after day, email after email, phone call after phone call. Indeed, from individuals at my town halls. The weekend before last, I held a lot of town halls and a couple special health care forums and a bunch of Main Street walks in Oregon. 5 of those town halls were in counties that are very red, very Republican, and I lost those counties in my reelection by rates of probably 20 to 40 to 50%. But at those town halls, people came out and said, please stop Trump care. 1 out of 3 individuals in rural Oregon, in Republican Oregon, are on the Oregon Health Plan. They remember that not so long ago, all they had for a health care plan was to say a prayer each night and hope that they didn't get sick the next day. Say a prayer each night and hope that they weren't going to be in an accident the next day. That's all the health care that they had. But now they're able to get preventive care for free. Now they're able to take their children in and get them inoculated. Now they know that if a loved one in their family becomes ill or injured, that loved one will get the care that they need, and they won't go bankrupt in the process. That's peace of mind. And isn't that the kind of foundation we want to enable every family to thrive in America? Shouldn't we consider health care to be a basic right, a basic service that is provided with a health care system in a we the people nation? Not a we the privileged nation where the only health care is available to those who are rich enough to buy it. That's wealth care. That's not health care. Not a health care system in a we the powerful, where the powerful write the laws to benefit themselves, but leave everyone else out in the cold. No, a we the people nation, a health care system suited to we the people, where we provide streets and we provide public transportation and highways as part of the common infrastructure, where we provide public schools, free public schools, so that every child has a chance to thrive, and where we provide public health care so that every citizen can have the peace of mind that if their loved one gets sick, they will get the care they need. But we saw the opposite this year. We saw the House bill that would have thrown 12 million people off of health care within a year and 23 million within 10 years. And the president, weeks after he celebrated with his champagne glasses and his leaders from the House, weeks after he celebrated passage, someone told him what was in the bill. And the president said, wow, that bill is mean and heartless. And then we came to the Senate, and the Secret 13 met, and what did they craft? A bill that was even meaner and more heartless. Instead of throwing 12 million people off health care in a single year, it threw 13 million people off in a single year. And over 10 years, essentially the same number as the House. And it wrote a Medicaid provision that over every subsequent year would make Medicaid less and less accessible to the people who need it. Well, that ran into a dead end. So the Senate said, let's recraft something that's better. And what did they do? They threw in the Cruz Amendment. And what did the Cruz Amendment do? It's fake insurance, the fake insurance amendment. Do you remember those days when you'd get advertisements for health care and say, pay us $25 a month, pay us $50 a month, we'll give you a health care policy. And millions of Americans bought those policies, and they thought they had something valuable until they became sick and went to the doctor and were told, this doesn't cover your doctor visit. And it doesn't cover your x-ray. Doesn't cover your MRI, that's for sure. Doesn't cover the drugs that you need to treat this illness. Doesn't cover a specialist. Doesn't cover hospital care. Oh, and you're pregnant? How wonderful that you're going to have a child. But your health care policy, that fake insurance policy that you bought, doesn't cover maternity care. Fake insurance for the people of the United States of America. That's the Cruz Amendment that was added as a so-called improvement to the mean and meaner bill already crafted by the Secret 13. Fake insurance. And to make it worse, the fake insurance system means that the health care policies that cover essential benefits enter into a death spiral. They become so expensive, people can't afford it, so they don't buy them. And as a result, only those who are already ill buy the policies. And that makes the policies even more expensive, so even fewer buy them. There it is, the Cruz Amendment. Fake insurance for the young and healthy, and the destruction of insurance with essential benefits for everyone else, pricing it out of reach. In other words, it's like a bomb going off in the healthcare system to destroy healthcare both for the young and healthy and for the older and the sick and those with pre-existing conditions. So some experts weighed in and said, here's how terrible that idea is. This is how destructive this is, the health care of Americans. And suddenly there weren't the votes for the Cruz fake insurance amendment either. So now what do we have before us? We have the repeal and run plan coming to the floor of the Senate, repealing the exchanges. That is the healthcare marketplace where people can use subsidies to be able to buy insurance, enabling individuals who are struggling working families assembling a number of part-time jobs, often minimum wage jobs with no benefits, but they're able to buy insurance on this marketplace. By the way, this was the Republican plan for health care. Let's bring together a marketplace where people can compare policies and can get subsidies to be able to afford those policies. It was the Republican plan. It came from a far-right Republican think tank. It was championed by a Republican governor. It was test run at a state level by a Republican nominee who became the nominee of the Republican Party for the United States of America. Call it Romney Care, call it the exchange. It was the Republican plan. But my colleagues now say they don't like their own plan, and they don't like the expansion of Medicaid. They don't like the free preventive conditions. They want to get rid of the possibility of your children stay on your policy to age 26. They want to get rid of the Health Care Bill of Rights that says gender is no longer a pre-existing condition and you can't discriminate against women because they happen to be women. They want to get rid of the protection you have against policies that have an annual cap, which means if you get seriously hurt or seriously ill, you don't get covered. They want to get rid of the protection you have that says there can't be lifetime caps that destroy health care so that if you are seriously sick, then you not only hit your annual limit, you hit your lifetime limit, and no more care for you. And now you have a pre-existing condition, and you can't get a policy anywhere else. That whole set of consumer protections, a health care Bill of Rights. My Republican colleagues want to bring this bill to the floor to destroy that entire set of rights. And they say, well, and then after we've destroyed all this, destroyed the expansion of Medicaid, destroyed the funding for our health care clinics, somewhere down the road, we might figure out a new way to provide health care, even though they've had year after year after year after year after year after year after year. Let's count them all up from the years that we crafted the ACA, with an incredible amount of Republican input, by the way. More than 100 Republican amendments being adopted. All those years. And now what we have is the majority leaders, majority party, Republican plan to simply repeal all of these pieces that have given a health care Bill of Rights to Americans, that have given struggling Americans the access to health care. So we're just going to wipe it all away and have people return to where we were before, where the only health care insurance they had was to say a prayer each night. That is not acceptable in a we the people republic. And I know that as citizens across the country weigh in, they're going to say, as they again fill our inboxes and ring up our phones and visit our offices, that this is not acceptable. Not acceptable to make it impossible for an entrepreneur to leave a big company and found their company because they now have access to health care. That is a beautiful thing. We have launched small businesses by the thousands and thousands and thousands because people were able to get health care without being at a large company. Small businesses that used to have to just struggle to get any sort of coverage. Well, there have been a lot of battles between we the people and we the powerful over this history of the United States of America, this 241-year history. We've had those who wanted to suppress the ability of workers to organize and ask for a fair share of the wealth they were creating. They wanted to bust the union. But the union worked not only to have better benefits for the workers at the mine or the mill, but to have better work circumstances for all Americans, to have a 5-day work week, to have an 8-hour work day, to have overtime paid at time and a half, to have safer working conditions, to end the exploitation of children in child labor sweatshops, to have employer-based health coverage. Again and again, workers organizing in the workplace have fought just not only for benefits in that workplace, but benefits for all working Americans. That's a we the people battle against the powerful and privileged who want to squeeze the working people until they have nothing left. And we've had other we the people versus powerful battles. We had one back in the 1920s when the powerful said, let's deregulate everything about the banking system, let's turn it into a wild casino, and everybody will make a lot of money, and there was massive speculation, and the stock market ran up like this, and then it crashed. And when it crashed, it destroyed the finances of millions of American working families. It left millions of regular families homeless and destitute. My grandmother lived in a boxcar because of this reckless pursuit of more wealth and deregulation by the powerful and the privileged. Thousands of banks across the country closed. More than 1 million families lost their farms in the first 4 years as loans were called in. More than half of all Americans were impoverished. 90% of children in mining communities were malnourished. All because we, the privileged and powerful, wanted to crush we, the people. But we, the people, surged back. They elected a government that established protection for depositors' accounts in our banks, protection through the Federal Deposit Insurance Corporation. They elected government that said, let's regulate and create honesty and integrity in the stock market, the Securities Exchange Commission, so that it's a safe place to invest. You can invest with confidence for the facts. They created the Tennessee Valley Authority that provided electricity and modernized the impoverished Tennessee Valley region. And they forged Social Security so that the first time Americans could count on having some income when they retired. We had another we the people versus we the powerful battle in the civil rights movement. There were those who wanted to suppress opportunity on the basis of race, on the basis of ethnicity. But we the people came together and said, here in America is going to be a land of opportunity for every single individual. No matter your race, no matter your ethnicity, you get a chance to thrive here in the United States of America. The doors cannot be slammed in your face. That incredible 1964 Civil Rights Act, forged right here in this chamber where I am speaking at this very moment. That was an incredible we the people moment. But it's not a battle we've completely won. Because still even today, in many states across our country, doors are being slammed legally in the face of our LGBTQ community. So shouldn't we come back together and pass the Equality Act and give every single American full opportunity in our country? Right now, as we come to the conclusion of the health care battle between the privileged and the powerful and the people, we have a chance to step out of the extraordinary partisan role that the majority in this chamber has played, treasuring power over health care in order to, well, in order to what? What purpose? To what purpose, what mission is being fulfilled? Yes, more deaths on that side of the aisle than this side of the aisle. But shouldn't we be here to solve problems? Shouldn't we work together to make our healthcare system better? Buried deep within that Mean and Meaner bill, there's a couple provisions that would make our healthcare system better. There's reinsurance, which enables a company to go into a new healthcare marketplace and be insured against having a disproportionate share of sick people. That makes a marketplace function. And remember, this was the Republican marketplace plan. And they have a provision deep in their bill that would make that marketplace work better. The marketplace requires healthcare companies to know how much they're going to get paid. And right now that's in limbo because President Trump has held up the cost-sharing payments and won't commit to them, so nobody knows how to price their policies. He's driving healthcare companies out of one county after another after another. They're saying, we don't know how to price our policies because we aren't told how much will be compensated. Well, there's a provision deep in within that Republican bill that says we're going to nail down the cost-sharing payments. There's another provision in that bill that says we should spend more to take on the opiate epidemic. Let's pull that out. Let's work together. Let's take the cost-sharing lockdown and the reinsurance proposal and the funding to take on opiates and other drug addiction across this country. Combine them together, and we have something that we could do to make our current healthcare system better. And to make it better as we work en route to having a healthcare system where simply by virtue of being born an American, you have basic, affordable, quality healthcare. We're a ways from that, from a Medicare for all or a Medicaid for all, but shouldn't we aspire to have that kind of peace of mind rather than the complexity of the system we have now? But at this moment, we have the opportunity to set aside our partisanship and make healthcare work better for our we the people nation. And we should seize that moment. Thank you, Mr. President.